Well, hey there, it's Dr. Franklin, and in this presentation, we're going to talk about seeking and using healthcare services. As I begin, there's a few questions that I just want you to consider. Some of these questions are the following. When and how does a person consider themselves sick? When are symptoms dismissed as inconsequential? When does a person decide that their illness requires treatment by a professional? When does a person decide if their own treatment will suffice? We will address these questions and concerns in this presentation. We'll start by discussing some common factors that are connected to our ability to recognize symptoms. The first factor we will discuss is individual differences. Sometimes these individual differences show up in terms of psychological disorders. For example, hypochondriacs have a tendency to think that normal bodily symptoms are indicators of illness. Even though they only comprise 4 to 5% of the population, individuals with symptoms indicative of hypochondriasis have a tendency to use medical services more often. Age is also a factor that is connected to recognition of symptoms in that older people report more symptoms than younger people. People who are high in neuroticism have a tendency to erroneously believe that they have serious diseases. Neuroticism is a pervasive negative way of viewing the world marked by negative emotions, self consciousness, and a concern with bodily processes. Neurotic individuals may exaggerate their symptoms or they may simply be more attentive to real symptoms. People who are focused on themselves have a tendency to notice symptoms more readily than people who are focused externally. Just consider the person that has a boring job, a person that's socially isolated, a person that keeps house for a living or lives alone. This individual may have more of a tendency to recognize symptoms than a person who has an exciting job, an active social life, and they also work outside of their home or perhaps live with others. Situational factors certainly play a role in whether a person recognizes their symptoms. A boring situation provides an opportunity for someone to notice symptoms versus a situation that is stimulating and requires a great deal of activity. Research has highlighted that people are more likely to notice a tickle in their throat or an itch during boring parts of a movie more than during interesting parts. Any situational factor that makes illness or symptoms especially salient promotes their recognition. Did you know that simply learning about different symptoms, illnesses, and disorders can cause people to imagine they have it? It's true, and it's particularly the case for medical students and psychology students. Studying symptoms leads students to focus on their own fatigue and internal states, and as a consequence, symptoms of whatever disorder is being studied seems to emerge. Stress may precipitate and or aggravate the experience of symptoms as individuals that are under considerable stress may believe they are more vulnerable to illness and they may interpret their physiological changes as a serious condition. Research highlights how people in a good mood or have positive expectations rate themselves as being more healthy and they report fewer symptoms, and even individuals with diagnosed conditions report less symptoms if they have positive expectations and a good mood. Now let's move forward and talk about the interpretation of symptoms from a social and psychological perspective, given that some individuals may go to the emergency room for a sore throat or mild soreness in some extremity. Prior experience factors into the interpretation of symptoms because if an individual has a symptom that has been ruled not serious in the past, then said individual may have more of a tendency to estimate the prevalence of the disorder greatly and regard the symptom as less serious than individuals with no history. Expectations factor into the interpretation of symptoms in that individuals will ignore unexpected symptoms and amplify expected symptoms. This is especially the case when an individual feels vulnerable to illnesses, and they may even regard individuals in their environment as being disease carriers. It should be noted that highly valued areas of the body are usually interpreted as more serious than are symptoms that affect less valued organs. For example, people feel especially anxious when their eyes and head are affected, but less anxious when their trunks are affected. Now let's move forward and talk about cognitive representations of illness. People hold beliefs or cognitive representations about their illnesses that affect their treatment seeking behavior. These conceptions are acquired through the media, through personal experience, and from family and friends who have had experience with similar disorders. Now, some of these beliefs are quite sketchy and inaccurate, and some of our beliefs are detailed, technical, and very much complete. These health beliefs influence us by influencing how we go about engaging in preventive health behaviors. It influences our reactions to experiencing symptoms after diagnosis. It influences adherence to treatment recommendations, and it also influences health outcomes. Now, these basic beliefs include information about an illness, and it involves information on the diagnostic labels that are used to describe the illness or identify them, the cause, the consequences, the timeline of the illness, control versus cure, and ultimately coherence, how our individual conceptualizations of illnesses tend to hang together in our minds. So, along those lines, we have beliefs about acute illnesses, illnesses that come on rather rapidly due to viral infections or bacteria, chronic illnesses, long lasting illnesses, as well as cyclic illnesses, which have a tendency to be seasonal. Now, let me just recap that again. Acute illnesses are thought to be caused by a specific viral or bacterial agent, and it is short in duration. An example of a acute illness is the flu. Chronic illnesses are thought to be caused by multiple factors, which very much include health habits, and these chronic illnesses tend to be long in duration. An example of a chronic illness is heart disease. And then finally, a cyclic disorder is marked by alternating periods during which there is either no symptoms or many symptoms. An example of this is herpes. So one's view of an illness can vary greatly, and it can also strongly influence behavior as it relates to prevention and treatment. For example, one person could see herpes as an acute illness that is easily treated and eliminated, and another person could see it as a cyclic illness that is a lifelong condition. Now, these two different people will treat their disorders differently, right, based on their conceptualizations, and they will maintain different levels of vigilance towards symptoms or the possibility of getting the illness, and they will also show different patterns of seeking treatment. Now, needless to say, sometimes people's conceptualizations of their illnesses match those of their healthcare providers, and sometimes they do not, and some psychoeducation is very much needed. So we're still talking about factors related to interpretation of symptoms, and we cannot have this discussion without mentioning lay referral networks and the internet. Lay referral networks also influence how a person chooses to interpret their symptoms. A lay referral network is an informal network of family and friends who offer their own interpretations of symptoms, often well before any medical treatment is sought. You ever had a cold and told a family member and they told you to just sit down somewhere and sip on some whiskey? I have. I've had that experience. I've actually, on another example, my brother-in-law fell off the porch of his home and he broke a bone. And my father-in-law told him to go lay down and that he would be okay once he woke up. Lay referral networks, saving the world one referral at a time. Who has not heard or at least thought to themselves, if I go to the doctor, they're not going to say anything I don't know, and all I'm going to have is a big bill. So we've all had these experiences. We all have our informal lay referral networks. Now, in some communities, the lay referral network is the preferred mode of treatment, and in some communities, causes and cures of diseases would be regarded as supernatural or suspicious by traditional medicine. Home remedies may be recommended, and it may be strongly believed that these are more effective than traditional medicine. Finally, the internet definitely weighs in on how individuals go about interpreting their symptoms. After all, it is a lay referral network within itself. It's comprised of several networks. 4 in 5 of every internet user has searched for healthcare information on the web, and there are more than 100,000 health related websites currently in existence. People that use the internet for health reasons say that it has improved the way they took care of themselves. Though physicians and patients believe that it affects healthcare positively, it's worth noting that there is an abundance of information online that is inaccurate, and some individuals that use the web to get more information about their condition just end up getting worse. So I'll end this presentation by talking about who uses health services and the misusage of health services. In terms of age, it appears that the very young and elderly use health services most frequently. Usage of services tends to decline in adolescence and throughout young adulthood. Towards middle adulthood and the elderly age, it starts to ramp up again. So uses of health services increases again in late adulthood when people tend to develop chronic conditions. So, in terms of gender, women tend to use healthcare services more than men because of how men are socialized in certain areas, right? Think kind of machismo. You're not supposed to express emotion or pain. You're supposed to be like John Henry and just power through it, right? So socialization plays a role in women using healthcare services more than men because of childbirth. Need I say more? And also because women have more homeostatic mechanisms than men and can more readily detect bodily changes. And lastly, one of the reasons why health services tend to be used more by women is that they have fragmented healthcare, which may involve seeing specialists for different aspects of their health. So think about it. Ladies have to get pap smears with the gynecologist. They have to get a mammography. Type of service with a breast cancer specialist, and then they go to their primary physician for a general physical. So that's a lot of moving around in health services to get all of their bodily needs taken care of. Now, in terms of social class, the biggest gap between the poor and the rich is the usage of preventative health services such as inoculations against disease. Preventive care often lays the groundwork for poorer health across the lifespan. Unfortunately, lower social classes use medical services less frequently than affluent classes, though this gap may be decreasing with the usage of Medicaid for the elderly and with the implementation of the Affordable Care Act. Finally, the usage of healthcare services is influenced by health belief models and the socialization that individuals receive from their parents. If a person perceives that they are facing a threat to their health, they may have a tendency to use healthcare services. So that kind of goes hand in hand with the health belief model. And just as a person learns health habits from their caregivers, bathing themselves, taking care of their hygiene, vitamins, balanced meals, etc., they also learn when to use healthcare services from their parents as well. Unfortunately, the misusage of health services is a prevalent issue. Health services may be abused, and this occurs when people seek out treatment for problems that are not medically significant. And another type of abuse occurs when people delay seeking health care for a problem. Physicians estimate that as much as a half to two-thirds of the time is taken up by patients whose complaints are psychological rather than physical or medical. This is a real issue, folks, that often occurs because psychological disorders, for example, anxiety disorders or mood disorders, often have physical symptoms as well. And sometimes psychological symptoms of these disorders may cause an individual to over exaggerate the extent of their symptoms and in some cases downplay it. Now, some people abuse healthcare services because having a physical issue is more socially acceptable than having psychological difficulty. So think about what I just said there. It's more socially acceptable to say I broke my arm versus you saying that your heart is broken and that you're dealing with some depression as a result of a relationship gone bad. So that certainly affects how individuals go about using health services and how they go about presenting their issues. Other reasons for misusage include secondary gains. Come on, I know you know how people treat you when you're sick. So they had no desire to treat you to Red Robin when you were well, but the minute you felt ill, they were willing to kill a chicken, find some noodles, and bring you some soup. So, the secondary gains that come from being sick are real, and many individuals will malinger so that they can get excuses for work or so that they can get attention from others. Now, I want to briefly touch on delayed behavior as it is a misusage of health services. Unfortunately, individuals don't use health services as early as they should. Now, sometimes this occurs due to lack of finances. Sometimes it occurs because individuals are trivializing their symptoms or perceiving their symptoms as minor. Sometimes it occurs because one is able to accommodate their symptoms. In other words, they're able to work around it and they may have a lot going on and just decide to keep pushing forward. And then sometimes this may happen because someone's curiosity has been satisfied by their first visit to the doctor. So maybe they don't think they need to follow up on said issue. I focused on the patient abusing healthcare services here, but I want you to understand that physicians are not without fault given that they may misdiagnose. They may assume psychological disturbance when real medical problems exist, and even with all the education that they have, physicians make honest mistakes. Well, I want to thank you for tuning into a presentation on factors connected to seeking and using the healthcare services. I hope you gleaned something from this presentation. Feel free to like, feel free to share, and feel free to comment below. And thanks again. Be well, be safe, and I look forward to educating you more soon. Take care.